Good afternoon. It is 1 p.m. on a Wednesday, and if you're listening to us, you're tuned into Kofifi 97.2 FM, or seen our beautiful faces on our Randburg Clinic School Facebook page. My name is Nazreen McGaw, and I'm a PL1 teacher at Randburg Clinic School. Today, we're off-site and in the Child's Play Therapy Center, and today I'm here with my lovely guest, Karen. Karen, welcome to our show. Please can you introduce yourself and tell us something specific about you?
Of course, thank you for having me. So I am an educational psychologist and also the owner of Child's Play Therapy Center.
And Child's Play Therapy Center, does it just mean play therapy center, or is there more to what you have to offer?
There is so much more to what we do. Play therapy is a very big part of it. As a practice, we do assessments and therapy. So that includes play therapy for the little ones and talk therapy, grown-up psychotherapy for the older kids and adults. And our assessments also range from probably around 2.5, all the way through to adulthood.
So you say 2 to 2.5. So I'm asking at 2, what if the child, for example, is verbal, but the speech is not that great? How would you do the assessment then?
So there are specific assessment measures that we have for our less reliable speaking kids. And those typically take the form more of a developmental assessment.
Okay.
So we're looking then at activities and tasks that don't require verbal output from them.
Okay.
And also rely less on receptive understanding on their part. So as the assessor, it would include more demonstrations from my side, or kind of those visual prompts to support in case the language isn't there.
So it will help them like either point or put the piece together to show you what they're understanding to get a result.
Absolutely. And so if we're doing, for example, checking motor skills,
Yes.
so jumping or hopping or skipping, those assessment measures allow me to demonstrate it to them. So I will hop so that they can see what they need to do.
Yes.
We're not necessarily checking that they can do it completely spontaneously if we're concerned about language.
Yes.
We want to give them the opportunity to show us the skill, even if the language skills aren't there yet.
Okay. And then you speak about play therapy. Why did you choose play therapy?
There was something about the psychology field that always just captured my interest and my attention. I think I was about 8 the first time I told my mom I was going to be a psychologist. She tells me that she didn't take me seriously because everyone finds psychology interesting, and so everyone's going to be a psychologist. But no, I actually meant it. And then during my undergrad studies, actually, I worked with children with autism.
Okay.
And that just captured my heart. I fell in love, and neurodiversity is still one of the things I work the most with in practice today.
Okay. So you say you work with neurodiverse kids. Do you work with neurodiverse adults?
I do. That's actually one of my passions, and partially why I chose psychology, to come back to your earlier question, is the variety in what I get to do.
Yes.
I can work with a little human and an adult all in one day. I can do therapy and assessments. My days never look the same, which is great. But yes, neurodiverse, children, teens, adults, the whole story.
And obviously they're also different, right? Because, you know, at Randburg Clinic School, we also for kids with autism. And we know that every day you show up and it's not the same. So how do you handle every day?
That's a tough one. Mostly, I think, because I don't really think about it as handling a different day every day. It just sort of is the norm.
Yes.
And I'm sure you find it
Yes.
as well. To an outsider, it looks like we have a different interaction each time. But when this is what you do, that different becomes your normal.
Yes. So if it was predictable, we'd be like, wait, it would be unsettling for us.
Yes, exactly. Who wants predictable? That's boring.
No, definitely. And then, how long have you been practicing play therapy? And typically, is there a specific age group you like to focus on? I know you mentioned there's a variety, but is there something that you gravitate more towards?
So, sure, the question about how long I've been practicing, I should probably have worked that out at some point. I want to say about 7 years, give or take. Please, nobody judge me on my maths for that one. And then in terms of age groups, so my primary focus within the practice is either the under fives or adults. Maybe a kind of late teenage, early adulthood as well, but it's kind of the two ends of the spectrum.
Yes,
for me.
No, definitely.
And then the other psychologists in my team will see the in-between.
In-between.
Yeah.
Is there ever a time that you find yourself seeing the in-betweens?
There is. It can happen for a variety of reasons. Sometimes it's that I've done the assessment for the child, because I'll assess all ages. So sometimes it's a case of I've done the assessment and either the child or the parents feel strongly that I continue with the therapy after that. Other times it's just based on the almost area of expertise or competence, that for whatever reason, as a team, we decide that that child and I would be the best fit in terms of therapy approach.
So let's say you see me, and currently I'm only having the ability of much younger than, and I fall into those age groups. Mm-hmm. Would you then adjust and see me even though my age says I'm 39 and I behave differently or I respond cognitively differently? Would you see me, find the age I'd fall into, or how does that work?
It's very case dependent or specific. I always tell parents my primary goal in the practice is to pair the child with the therapist that's the best fit for them. So although we kind of have guidelines that, for example, our receptionist will use when an inquiry comes in, like under fives are probably going to go to Karen.
Yes.
Adults are probably going to go to Karen.
Yes.
That's not set in stone.
Okay.
So if for any reason, based on presenting reason for referral or kind of the dynamics, anything like that that's going on, sometimes personality between child and therapist, we will then kind of figure out, okay, we think this person is the best fit. So absolutely, yes.
Okay. And then how do you use this, like, do you use a specific therapy or type of therapy, like non-directive, directive, when you do in your play therapy?
I follow client-centered, non-directive the majority of the time.
Yes.
I find it to be the most effective in allowing children to be comfortable in the space and to trust the space and their own process.
Yes.
I am a firm believer that our kids know more about themselves and have more insights into their stuff than we always give them credit for. So the client-centered perspective or approach allows me to let them lead the sessions.
Yes.
The sessions are tailored to what they bring into the room, what they kind of gravitate towards in terms of toys or activity, and non-directive kind of aligns with that really beautifully. That being said, there are times, particularly a little bit later on in the process, where I might move to more directive approach, but never completely directive.
Yes.
So if, for example, I know we're working on managing emotions and regulating emotions, we might still have the majority of our session non-directive, led by them, but towards the end we might include a more directive activity like reading a book that I've chosen beforehand that I know will address that with them.
So, you know, like we say, neurodiverse learners, they need schedule.
Yes.
Do you have that approach? Do you have to guide them to what's coming next? Or do you just take it like you said, it's non-directive, so they play and or do their thing, and then you're like, okay, can we do this now? Is that how you do it?
That's also a little bit dependent on the child.
Yes.
As a general kind of rule of thumb, though, I would say that I do believe in giving our kids warnings
Okay.
for transitions. So even if we don't have a structure in terms of routine to our session,
Yeah.
I will never just spring upon them, oh, look, we're changing task.
Okay.
So typically if they have chosen, let's say, to play with a fire truck or the dollhouse, I'll say to them, okay, cool, we're going to do that now, and then in a little bit we're going to read a book. And then nearer the time that I want us to transition, I'll say, okay, we've got 5 more minutes to play with this, and then we're going to read the book.
So what do you do in a case where they don't want to move on? How do you get them to move on?
That's a very fine balance because we really want the therapy process to be cooperative.
Yes.
It's about cooperation and working together, not compliance.
Yes.
And so generally for me, it's about validating that emotion and those experiences of, I can hear you that
Yes.
you really don't want to stop playing with the dollhouse yet. And it depends a lot on the child. If I can see kind of where it's coming from,
Yes.
why does it they don't want to transition, we can possibly problem solve around it. So, okay, you don't want to read the book because you're scared we won't have time to play
Yes.
with the dollhouse again. And I promise, I can check that we'll have enough time at the end or something like that. In other cases where they don't want to do it, I respect that.
Okay.
Part of therapy is teaching our kids and our adults that their voice matters.
Yes.
That they are allowed to express their feelings, share their thoughts,
Yes.
and that those are valid and that we'll listen to them.
Yes.
And so I often think it feels a little bit hypocritical then to be like, I'm teaching you that lesson,
Yes.
but I'm ignoring what you're saying.
Yes.
And so in those cases, I will validate, acknowledge, and I will respect it.
So that also allows them to trust you.
Yes.
Because you're saying, okay, we're doing this. In a few minutes we have to do this. But if we don't get there, it's also okay. But not making it seem like that we don't have to eventually get there. Am I correct in saying that?
Yes.
Okay.
So 9 times out of 10, we'll read the book at some point.
Yes.
It might not be that session.
Yes.
If they really feel strongly about it that day. So I think where the activity I've chosen has a goal or a purpose, I'm never going to disregard it completely because somehow it aligned with what we're trying to achieve in therapy, right? But I might shift what it looked like.
Yes.
So maybe through that interaction, I realized this child really just doesn't like being read to.
Yes.
For whatever reason, that's what's causing the reaction. And so, okay, I'm not going to try read the book next time.
Yes.
Next time we might watch a video, or we might play it out with a puppet.
Yes.
Or so it is about trusting them and trusting their experience and what they need, and showing them I respect that.
Yes.
And keeping in mind the purpose of the goal. Like, what was I trying to achieve, and how do I do it in the way that works best for them?
So I'm sure you've heard about the learn through play approach. So is play therapy like that? Or how would you say it's different?
To an extent, definitely. In therapy, we would probably do it less directly.
Yes.
So in a purely non-directive, client-centered approach, you actually wouldn't even label some of the objects.
Okay.
So it wouldn't even necessarily be, I see you driving the fire truck. It would be, oh, I see you moving that.
Okay.
So that we're not assigning labels
Okay.
to the child, so
Yes.
that they really have almost a blank canvas to tell their story.
Yes.
Having said that, most of our kids will start out labeling
Yes.
things, and then, yes, absolutely, using kind of those questions or reflections, you can use those techniques to ascertain more information. So there's definitely overlap in
Yes.
that sense. The difference probably comes in just in terms of how directive
Okay.
it is.
Okay. So if you would describe to me how you would conduct your normal, like a usual
Mhm.
play therapy session, what would it entail?
So a typical play therapy session starts with child coming into the space. The first session with the child is always where we kind of discuss the boundaries of the room, and there are very few rules in the play therapy room. But so when the child comes in, let's say for a later session, they already know that the rules are basically that no one's getting hurt, not them or me or the toys, and we're packing up when we're done. Those are sort of the only restrictions from the outset. And so they will come into the room, and almost always, if they've been here before, they've decided either in the car park or on the way up what they're going to play with when they get here. And it's amazing to see how often welcome them into space and they go straight for a toy. That has been their plan. And it's, for me, it's always so lovely to hear. Often the parents will comment afterwards, like, you were talking about the dollhouse the whole way here. Did you get to play with it? Yeah, so, it sticks for them. And that's really how the session starts, is them coming into the space, choosing what they want to do for the day or for the session, and me then adapting to that and reflecting what they're doing, engaging with their play as much as they allow or ask me to.
So it's very interactive. It's not like I'd say like we see on TV, where you're just sitting in a room and you're like and and that's probably the wrong of what we see on TV is not really what it's about, So do you feel like, are they restricted to the toys they play with?
Not at all. So the setup in my room is that there are kind of open shelves with toys that they can choose what they want to play with. So there aren't restrictions in terms of what they choose or how they play with it. Yeah. So for example, if they take the cars out, and ordinarily, I think almost by default, we would think, okay, the cars are going to drive on the mat with the roads. Yes. If the cars suddenly turn into creatures that live in the dollhouse, or whatever the case may be, that's fine too. It's really about a space where they can express themselves and their thoughts and their ideas or their worries. So however it comes out for them is what I then work with in the moment.
So you told me like you build the trust in how you do the session, you allow them and they allow you, that kind of process. But in that, how would you measure the success of the session or your progress? How would you know that what you're doing is working? How do you know you have to make changes?
That's one of the hardest questions to answer with parents often, because, and I understand you're bringing your child to therapy because they're struggling with something, and so you want to know that there is a kind of a very clear outcome that we're expecting. And therapy, because it's often little, but because we're talking about play therapy, little people with big emotions and big personalities often, it's not as black and white as, ticking a box like you would in an assessment. There are goals that you kind of discuss and conceptualize at the beginning of the process, and it's really about, is the child's emotional well-being shifting? Are we seeing a shift or improvement in some form? And sometimes that looks like them sleeping better, or not crying at school drop-off anymore, or being willing to try new foods, being confident in a new space. So it's not always a tangible, we'll greet most people when they see them type of thing. It's just that ability, or that we can see that shift in terms of an improvement in what we were working on, whether it's confidence, self-esteem, addressing conflict, whatever the case may be.
And how often do you have to do an assessment?
That depends on why we're doing the assessment. Typically within the practice, our assessments are either developmental, so those are the ones for the very littles, or it's a psychoeducational assessment. And so then that's helping us determine cognitive strengths and areas for growth, academically, where they are, and emotionally as well. And those assessments we typically need to redo every couple of years if it's for concession applications. So if we're applying for the child to have, for example, extra time, a scribe, anything like that,
Yes.
those need to be regularly updated. If it's not for that purpose, if we just have parents or teachers who kind of, have identified that there's something going on, and so
Yes.
we're just trying to get an understanding where the child is at, it's still a good idea to update the assessment
Yes.
every now and then so that we can also see that our interventions are working.
Okay.
If we're going to put things in place, or if I'm going to suggest to you as a teacher, please do X, Y, and Z in the classroom for my kiddie, at some point I'm going to have to check whether those things I suggested are helping
Yes.
or not.
So how often would you give feedback? So it's like, do you give feedback after every session, or is there a number of sessions before you're like, okay, this is what we've done, this is what I see, how does it go, how does it work?
For therapy, we typically give feedback every 4 to 6 sessions.
Okay.
I must be honest, more and more I'm finding that the 6 sessions is the better marker. It really gives us time, especially for the first set of sessions, for the child to develop a relationship with
Yes.
us and learn to trust us in the space.
Yes.
Anyone who's been to therapy will tell you that it's not easy to sit down and open up to somebody. So even if our kids are doing it through play,
Yes.
we're still asking a lot
Yes.
of them. And so I often say to parents, I can give you feedback sooner, but I won't have much of value to say because they're still settling in, they're still getting used to the space. So it's usually after 4 to 6 sessions, and then every 4 to 6 sessions after that.
Okay.
I don't believe in keeping a child in therapy indefinitely
Yes.
or longer than they need to be.
Okay.
The idea really is that I work myself out of a job. I
Yes.
work that they don't need me.
Yes.
And so absolutely they can come back as and when they need it. But for me, that regular feedback is really important in making sure, yes, we're making progress, and also that we're all on the same page. So the strategies we've recommended be implemented at home, for example,
Yes.
are happening or aren't working. Let's figure out why. Same thing for at school. That kind of collaboration at each feedback session is also really important.
So how long is your typical session? I think I should have asked this a lot sooner, but I just realized now that we're talking about these sessions, but I don't really know how long they are.
From, I would say, probably about 6 or 7 years old, our kids can typically manage a 50-minute session.
50?
Yeah,
Okay.
50. Not always. Sometimes they need a little bit shorter. And so the little ones that I work with, let's say, for example, like your 3-4-year-olds, those sessions are usually half an hour,
Okay.
maybe 40 minutes. My philosophy there also always is that I would far rather the session is that little bit shorter
Yes.
and the child leaves wanting to come back and still play with stuff,
Yes.
rather than we dragged it out to 40 or 50 minutes for no real reason.
Yes.
And so it actually starts to feel like a chore
Yes.
for them. So their sessions, depending on age, will vary between half an hour and 50 minutes. And then the initial consult or feedback with parents is normally also 50 minutes to an hour.
Okay. And then you said earlier about strategies. You check if those strategies are being implemented at home or at school. Are the same strategies given for home and school?
Sometimes it depends if we're seeing the same behaviors
Yes.
in both environments, which I'm sure as a teacher we
Yes.
don't always. And that for me is always so interesting. Like why are the two scenarios so different?
Yes.
But either way, in those cases, the strategies are tailored to the environment. So, and that, to be honest, is actually true of every child.
Yes.
For me, there is never a generic set of strategies that I give to parents. And I also, often parents will come to the initial consultation wanting strategies or suggestions already.
Yes.
And I always say to them, it would be doing you a disservice to do that now.
Yes.
Let me get to know the child. Let me try some of them in therapy and see what happens.
Yes.
Because every now and then, that's when I realize I'm really not going to cope well
Yes.
with whatever my idea is. And so that's what lets me then tailor it to, okay, at home, can we try X, Y, Z? At school, maybe let's try this. And that is also really dependent on feedback from the teacher. And so with all my therapy kids, I ask the parents consent to contact teachers, other therapists, kind of whoever else is involved in the child's life and support, because that collaboration to me also makes a really big difference.
Yes. So tell me, if someone were to want to see you, what is the process they have to follow? Do they need a referral? Or how could they just be like, maybe this would benefit my child, let me call you, make an appointment? How does it work?
So regardless of how the inquiry comes in, and we will talk about those options now, the first step will always be an initial consultation with the parents, because that lets me get the necessary background information, make sure I understand as much about the child as I can before I meet them and start the therapy sessions. From there, we would then schedule the therapy. It's typically once a week for those 4 to 6 sessions, and then we would meet again for feedback. In terms of how the inquiry comes into us, often it is through a referral, either from a school, another health professional, something like that, but it doesn't need to be.
Okay.
If as a parent you realize, I see a bit of a change in my child's behavior, or I know that they went through this traumatic event, or there's a big change coming up.
Yes.
We're moving house in 2 months' time, for example, or whatever the case may be, and want to start the therapy process almost proactively, preventatively, then that's absolutely amazing. Then we do that as well.
So you don't have to wait for an incident. It can be like, okay, maybe there's something coming up, let's help the transition.
Absolutely. And so often we find that to be really beneficial, because it's almost giving the child the skills and the space to cope before they need it.
Yes.
So when the event comes, when we now start a new grade or a new school, we have a person that we can talk to about it or play it out with.
Yes.
And we already maybe have some coping strategies in place. You spoke earlier about how our kids tend to thrive on structure and routine and things like that. And so even just very practical strategies that we can suggest to parents to make a transition smoother or easier.
Okay.
So kind of being proactive is always a good thing.
Okay. And tell me, what are the most common challenges you find or you see in children with special needs? And how do you use play therapy to address those?
I'd say the most common challenge is probably around emotional regulation.
Yes.
And how that then manifests. I think it would be very easy to say that the most common challenge is behavioral, and I'm deliberately not going that way, because to me that behavior is a form of communication.
Yes.
If our kids could act differently, they would.
Yes.
So if there are what is looking like behavioral challenges, that is communicating an unmet need or a skill that they maybe haven't developed as well as they should have, or could have at that point. And so if I think about just the practice and the cases we work with, that would probably be what I'd say is most common. In terms of the therapy process, the changes or accommodations that we make are more around logistics or the practicalities of it. So making sure that the toys are accessible to them. So, for example, it might not work to have the toys on the shelves. Some of them may need to be on the floor, for example, or we may need to move some furniture out for those sessions so that a wheelchair can fit in. So the accommodations are more on the practical side, because the client-centered, non-directive approach actually caters for their other challenges automatically.
Okay. And how do you make your therapy sessions inclusive? I know you said you adjust the room, the toys must be reachable, all of those kind of things. But if we look at, let's say, white, and they say they are black dolls, how do you incorporate that into your lesson? Shouldn't say a lesson, but into your session. Let's say it's it's not even about race.
Mhm.
We're just saying like, how do we make it all inclusive? Like, cause there's different people. They see each other differently, and I know, or I believe that color is taught. We all human beings, right? But like, how do you make it? Okay, let me say an animal. Like, so if the child comes here and the child uses the cat, but the cat doesn't meow, the cat talks.
Mhm.
So how do you direct that?
You've almost answered the question yourself, in that often our kids will, I almost want to say, make it inclusive themselves.
Yes.
They won't necessarily gravitate to what we would expect
Yes.
as the projected figure.
Yes.
It often is something less threatening, like an animal or a puppet or a car, because that takes away the closeness. And so subconsciously, they actually create that distance
Yes.
themselves. In terms of inclusivity, already the approach that we use in terms of being client-centered creates a space for a recognition of that diversity, and it can be difficult.
Yes.
And it's something that I think as therapists, especially in South Africa, we need to work on daily at
Yes.
kind of, yes, making sure we're mindful of that and intentional about it,
Yes.
because it can be easy to sit in a position of privilege and forget
Yes.
that. So for me, part of it is being mindful and intentional, and kind of really trying to understand the child's background and context.
Yes.
And that's also why the initial consultation is so important, so that we get to know, okay, who is in the family structure, for example, who are the important role players, because that might look different in different
Yes.
cultures or for different families. And then, like you said, representation within the therapy space is important
Yes.
as well. So where there are, yes, figurines, for example, to try and have those available in different races,
Yes.
dolls available in different races. And having said that, sometimes our kids, you can have all the options and our kids will choose to be a cat anyway.
Yes.
That's
They already know what they gravitate towards,
Yes.
regardless of where you trying to direct or not direct
Exactly.
them. They just have an idea already.
Yes.
So, what if you have a child that comes and sees you and they face sensory issues?
Mhm.
How does that help you? How does that affect or improve or your session? Like, what happens? Because I know sometimes they won't touch something
Mhm.
because of that sensory. So, what do you do then?
The sensory is a big part of it, and it's a really good question, because I need to start the answer with the transparency of we're not OTs.
Yes.
Right? We don't have that level of sensory integration training. So there is an element there where I do sometimes wonder if we're doing enough in terms of a sensory
Yes.
component. As a practice, I've worked really hard though to have occupational therapists come in and speak to us on sensory regulation strategies, ways to identify when a child is dysregulated and what their sensory needs might be. See if they're in occupational therapy or have a sensory profile already. That's
Yes,
amazing, because we can draw on
yes.
that. But I want to say, I think there's a part there where experience plays a role as well.
Yes.
You kind of get a sense for your kids and what they need, and we do then try and incorporate that where we can. And exactly like you said, respect their sensitivities and aversions
Yes.
as well. And the same goes for therapists. I always remember when we brought an OT in to speak to us to help us regulate our kids in session, she spent a fair amount of time on our sensory
Yes.
process.
Yes.
And so, you know, it's that fine balance of our own sensory stuff
Yes.
and the kids and managing that, because, and I mean, you will know from your experience as well, a child that is dysregulated on a sensory level, it's that much harder to reach on an emotional, cognitive level. And so we do work really hard to create a space that isn't overwhelming on a sensory level, that does respect their sensory preferences,
Yes.
and we will absolutely ask for help
Yes,
where we
no,
need it,
definitely.
either from their OT or their parents, or, you know, even if it's just outside kind of consultation supervision in terms of what we can try
Yes.
to make the session more beneficial for them.
Okay. I think we're going to take a break. Let's see what one of our segments have in store for us, and we'll be right back.
Hello and welcome to Education Segment by RCS Media. My name is Robin Amoretti and I'm the speech language pathologist at Rambo Clinic School. Today I'm going to be talking to you about autism. So what is autism? Autism or autism spectrum disorder, or sometimes just ASD, is a neurodevelopmental condition. This means that it is a lifelong condition that affects how the brain develops and functions. ASD is characterized by persistent difficulties with social communication and interaction, restrictive and repetitive behaviors, interests, or activities. But what does autism look like? Autism looks different on everyone. Each person has their own strengths and challenges. For example, some autistic people find speaking challenging and are non-verbal or minimally verbal, while others can communicate verbally or with pictures or with gestures. How common is autism? Globally, 1 in every 1,000 children has autism. In South Africa, the rough estimate is roughly 2% of our population has autism. Anybody can be autistic, regardless of sex, age, race, or ethnicity, but research has noted that it's more common in boys. This may be because autism looks different in girls and it's unrecognized by doctors. What causes autism? There are many causes, but research says it's a combination of genetics, environmental factors, and social influences. An example of environmental factors are things like older fathers, pesticides, low birth weight, and prematurity, among others. Is autism on the rise? It does feel like it is, but this is also because the world is more aware of it. The diagnostic criteria is now broader, and our screening tools are better. So what can you expect from RCS Education Segment? We hope to provide a platform for learning about ASD, as well as tips and tricks on how you can work with children with autism. I hope you enjoyed this video. If you did, please give it a like, share it, and stay tuned for more videos.
Thanks for coming back. I'm still with Karen, and we are still at Child's Play Therapy Center. So Karen, you told me how you collaborate with teachers, OTs, but your practice has many other therapists, and they all have their specific niche. And how do you collaborate together?
We try more, not as often as we should probably, but we really try to get together as a practice every now and then to kind of case consult, work through kind of challenges or get ideas from each other as and when necessary. And you're absolutely right, everyone does kind of have their area of competence, or that they have a bit more experience with. And so it's one of the benefits of the group practice, is being able to bounce ideas off one another. Obviously, we are always very, very careful to maintain confidentiality and the ethics around it, but just to be able to share those ideas, or, you know, those moments of, I don't know what I'm doing, help, or have those aha moments, it's really helpful in terms of our professional development, but also continuing the care we give to our clients.
So is there ever an instance where you saw a client for a period and then they moved on to another therapist, and you'd have to give some insight into what you experienced, or is that not allowed at all?
It does sometimes happen. There are cases where, I'm just thinking off the top of my head, it probably happens most where one of us has done an assessment,
Yes.
and then a different therapist does the therapy, or a different psychologist does the therapy. But there have been instances in the past where we have had to hand over cases for a variety of reasons. Sometimes it's something like a psychologist going on maternity leave, or just sometimes it's based on availability, that, you know, we saw a client maybe a year ago, they've come back for therapy. Between their extramurals and our diary, it works better. Or now, because of their age or what they're presenting with, that it might work out that another therapist is a better fit. And then in those cases, we would do some sort of handover, but always with the parents' permission and consent.
And then how would you do the transition? Would you have a session where you are both there and then give them the insight that this might be the change coming up? Or how do you go about that?
That to me depends quite a lot on the age of the child.
Okay.
And also their reason or experience of being in the therapy space. We have actually done exactly what you described, where we had the old therapist sit with the client and the new therapist and explain. Obviously, she had worked with her client on it individually, but then introduced her to the new therapist that, yes, she was going on maternity leave, so wouldn't be for a few months. This is who the child would be seeing, and just to kind of help that transition. I find for our older kids, it's often less of a big deal than we think it's going to be. They're just like, okay, new toys, new space, happy. There's actually very seldom been, I would say, like a difficulty with that kind of transition. I think our kids are a lot more adaptable than we give them credit for sometimes.
You actually forget how they can adapt. Sometimes you overthink the situation more than they do actually. So Karen, we spoke a lot about how you get feedback, and you mentioned parents, right? And sometimes we just assume that it's parents that are together, but we do have instances where there are parents that are separated. And how do you go about those sessions? How do you give back feedback to them? Are they together? Are they separate? Or how do you make them all feel included?
That's such a good question, and something that we do often face in the practice. Our philosophy is that we want everyone in the child's life to be included and ultimately to be on the same page as far as possible. Our preference is that for the initial consultation and feedback, that the parents are in the same room so that we can give kind of the same feedback at the same time to everybody. It's landing the same way. And, you know, we've had sessions where it's mom and dad and their new partners, everybody in one room, and we're very happy to do that. In other cases where parents really don't want to be in the same room as the other parent, there's not value in forcing that. And, you know, often we don't know the full history or kind of how they came to be. And so where parents request it, we will gladly do separate initial consults, separate feedbacks. We obviously keep very clear notes so that we know we're saying the exact same things over. But I think that is an important question, because I think that's sometimes what maybe puts parents off taking their child to therapy, is actually the thought of having to deal with their spouse or ex-spouse that they'd rather not sit in the same room with and discuss you know, emotional history with, kind of thing. And so there are absolutely ways that we can navigate that so that it still works out in the child's best interest.
So as much as you have to give feedback, in that situation where parents are separated, consent, what happens? Do you need both of them to give you consent? Or is it just one parent? Or what does it depend on?
We do need both parents' consent. There are so often conversations about this in all the ethics forums and groups and things. Our stance is that we do need both parents' consent. The exception to that would be where there is a court order that gives one parent full rights and responsibilities. But in that case, then we want proof of that. Because we've been in positions where we've learned the value of that. And the advice we've always received in terms of professional consultations is that we have done everything in our part to have both parents consent and involved. They can choose not to be involved, but they need to be aware of the process and consent to it.
So if they choose not to be involved, do you need that in writing? Or
it's always better to have the things in writing. there are cases where, for example, a parent might not have been involved in a child's life
Yes.
for many years.
Yes.
So let's say we have a parent sitting in front of us saying, I have no idea how to get hold of them. And in those cases, we then ask the parent to get an affidavit
Yes.
for us, confirming that.
Yes.
We will still make every effort on our part to contact that parent with the most recent kind of contact details available. But in those cases, sometimes that is just how it is. Yeah.
Okay.
And sorry,
No.
there's always space for the argument of in the best interest of the child. And that is what we work towards and for always.
Yes.
But we, as a practice, feel very strongly about respecting both parents' rights.
Okay, that is very important, and it's good to know that, you never feel like one is more important than the other. So what advice can you give parents on the art of play therapy?
Probably my biggest point of advice would be to not fear the play therapy process, because I think it can be daunting.
Yes.
And I completely understand that, especially if you think about our generation where therapy wasn't as accessible.
Yes.
So already we didn't go for therapy. We don't want to get therapy now, but now our kids must go for therapy. That can be intimidating. And this really, as much as we say it's an accepting space and a non-judgmental space for our kids, the same is true of their parents. This isn't about us picking apart what's going wrong.
Yeah.
This is a collaboration in terms of how can we support the child best. And so it can be daunting. I promise we will walk the journey carefully with you as parents. But also just that if you have a sense that your child would benefit,
Yes.
rather do it sooner. There is no such thing as intervening too early.
Okay. And then lastly, Karen, I'd like to know, how can people get hold of you? And most importantly, do you have a waiting list?
That's always a $1 million question, hey? So inquiries can be sent, your kind of, parents want to contact us, they are welcome to do it via email or WhatsApp, phone call, although I think we all have moved to a stage where we love WhatsApp. And yes, first point of call is almost always Kanye, our receptionist.
Yes.
And she is wonderful at taking down all information, making sure she understands exactly what the parents and the child are going to need from us, so that we can then, between her and I, determine which therapist would be the best fit. In terms of waiting lists, that changes kind of by season.
Yes.
At the moment, though, there's a bit of a waiting list for our assessments. Okay, if I'm honest, maybe for play therapy as well,
Yes.
but that also depends on the different therapists.
Okay.
So, you might find, yes, at the moment, one therapist caseload is very full and there'd be a waiting list, but if we think another therapist would be a good fit,
Yes.
we'll then communicate that to
Yes.
the parents.
Okay. So that is us. And I'd like to thank Karen for taking the time to allow us in her space and into her profession. Thank you so much for tuning in. We hope to see you next week, and let's see what the show has in store. Thank you. Bye.